People with MS are more likely to experience migraines than people without MS. Howdy, everyone. Aaron Boster here, and thanks for learning about MS with me. Today, we're going to be talking about MS and pain. When I attended medical school, I was taught that MS didn't cause pain. Quite literally, my professor taught me that. And my professor was wrong. Yes, MS causes pain. And it can be very, very frustrating, not just because you hurt, but because other people can't see it and other people may not understand. The next one that I want to talk about is migraine headaches, because people with MS are more likely to experience migraines than people without MS. Now, a migraine headache is typically described as a moderate to severe headache. So my first point is it doesn't have to be the worst headache you've ever had. Migraine headaches tend to be unilateral on one side of the head or the other. They're generally not on both sides. Now, interestingly, sometimes it'll be on the left and then the next headache, it'll be on the right. And that's not that uncommon. Typically, a migraine headache is described as a throbbing headache, and it will be associated with photophobia, which is doctor talk for sensitivity to light because the light hurts their eyes and causes discomfort, and sonophobia or phonophobia, meaning that noises really bother them. So being around loud noises makes their head hurt. And then a word that I may have invented, but osmophobia, meaning smell. Sometimes smells like perfumes will really set it off and it's really, really yucky. Sometimes migraine headaches are preceded by an aura. For example, someone will see shiny lights kind of in the periphery, almost like kind of pretty sparkly lights. And there's a doctor term for that, scintillating scotoma. And then after the shiny lights, they get a whopper of a headache. Sometimes people will get nauseated and then they'll get a headache. And I should say that migraine headaches are oftentimes associated with nausea and sometimes vomiting. Now, sometimes migraine headaches are just the headache. Sometimes people have migraine headaches and they have a neurological accompaniment. So someone might get a shiny light and then they get a whopper of a headache on one side and it's throbbing and they're sensitive to light and they're nauseated and they're having trouble finding their words, or they're numb in their hand, or they can't move an arm. You can have a neurological accompaniment, and it's super scary when that happens. It's not all that uncommon. Fortunately, we can treat migraines. There's a lot of different treatments for migraines. There's a lot of different pills out there. There are injections and there are shots. And I like to divide migraine management into two parts. There's the abortive agent, abort to stop. When you get a migraine, how to knock it out. And then separate from that, there's prophylactic therapies to prevent them from happening. So let's talk about both just briefly. So abortive migraines treatment, there's a couple things that are really, really good to know about. So let me educate you about that for a second. The treatments to abort migraines, to stop migraines, work the best the earlier you do them. So if you wait a couple hours to treat your migraine, you're way less successful than if you treat it as soon as possible. So the sooner you treat it, the better. When I gave the example of the scintillating scotoma, the shiny lights prior to developing a headache, that's when you want to treat the migraine. You don't want to wait for the migraine to fully develop. And I bring that up to you because a lot of patients, they'll say, well, I'll just wait and see what happens. Well, what happens is they have a whopper of a headache. So treating early is helpful. Most people are dehydrated. Now, you and I are not dehydrated because we're doing the MS Water Challenge. But being dehydrated can increase the frequency of headaches. It can make headaches worse. And one of the things you want to do when you abort a migraine is you want to crush some water. So if you're dehydrated, you want to power up that water, and that will actually help. The second thing is sometimes caffeine can help with migraine headaches. So some people find they'll drink a cup of coffee, and that will really help with their migraine. Now, abortive agents come in all different shapes and flavors. And there are a lot of over-the-counter drugs that can help abort a migraine. So these would be things like Tylenol and ibuprofen. And of course, you have to make sure that it's safe to take those from your doctor and that those medicines don't interact with other medications. And you can imagine, you start to think you might get a migraine, big glass of water, cup of coffee, and then some Tylenol or some ibuprofen to break the headache. Now, there are prescription abortive agents These are medications like Imitrex and Maxalt, and there's several of them out there. Ralpax, these are intended to abort migraines. And those are prescription medicines, and you have to make sure that they're safe with your doctor. And we don't want you using an abortive headache medicine more than twice a week. If you're using it more than twice a week, you're going to develop another problem called rebound, where you're doing it so frequently that you stop and it bounces back and you have a headache, and you take it and it bounces back and has a headache, and you really can get into harm's way. So enough about abortive agents. I have a video again about headaches on my channel where I talk about headache hygiene, and I talk a lot about abortive agents. So you can certainly check that out. Now, prophylactic agents, a prophylaxis is a preventative. And so if you have migraines too often, and we have to discuss what too often means, you might want to take a prophylactic medicine. Now, too often is different for all people. I find that if you're having a headache more than twice a month, particularly if that's leading to loss of work, that's way too often. And I want to offer you a prophylactic medicine. These are medicines that you take on a regular basis, once a day or sometimes twice a day, to prevent you from getting migraines, or at least to decrease the frequency. So just a couple words about the treatment of migraines.
Yep, migraines on one side, and I noticed it comes with significant low pressure systems are coming through. Migraines are brutal. I get migraines at least once a month. They usually last 1 to 3 days. Even with taking Imitrex, migraines are the worst. I have cluster migraines. I hate them. Migraines, my life. They started on one side and migrate to the other. They make my entire body flare up in knots.
Today's topic was pain and MS, because MS hurts. And a long time ago when I was in medical school and they told me MS didn't cause pain, they were wrong. Thank you so much for listening in. If you have not subscribed to the channel, please consider doing so. And if you're a subscriber, ring the notifications bell so that when I jump online to do a live stream, it alerts you and lets you know. My name is Aaron Boster, and I want to thank you so much for learning about MS with me. Take care and have an awesome weekend.